Hello, I'm Anita, and this is Care Experts, brought to you by CareCredit. With the CareCredit credit card, you can get the dental work you want or need now. CareCredit is accepted at hundreds of thousands of locations nationwide for preventative, restorative, and cosmetic dentistry. Today we're in Los Angeles, California with Dr. Daniel Naysan. Dr. Naysan is a member of the American Dental Association and specializes in aesthetic smile design. He practices cosmetic, general, and emergency dentistry in the heart of Beverly Hills. Today we're talking about chipped and broken teeth. Dr. Naysan, thank you so much for joining us here today. We're so excited to have you.
Thank you for having me.
So our first question is, what are common ways that people chip or break teeth?
So usually people from trauma, those patients that have a lot of wear on their teeth, where they clench and they grind their teeth, or they chew ice all the time, those patients, they're more likely to chip their teeth.
And what should someone do when they chip a tooth severely? Is there anything at home that you recommend they do or don't do?
So, obviously you want to just stay away and you don't want to chew on that tooth, and you want to basically avoid that area as much as possible. The other thing you can do, possibly if it's bleeding a lot, is to rinse with warm water and salt.
Will it get worse over time if you don't do anything about it?
It depends. If that person is putting a lot of pressure, if they're chewing ice, clenching, they're grinding their teeth, then yes, for sure.
And if someone were to chip their tooth severely, what should they just immediately go in and see their dentist?
Yes, because you're worried about a deep crack, and once that happens, and if it propagates deep into the gums, you're worried about having that tooth compromised and you needed to have it pulled.
And how do you treat the pain after someone has damaged a tooth?
So pain could be taken with over-the-counter medications. It depends if there's an infection involved. If that's the case, you need antibiotics, but it's usually treatable.
And what would be the various treatments for a broken or chipped tooth?
So from the more conservative level, it's doing a composite resin. Those are usually cases when you chip is a minor chip.
Okay.
But if you see, like if a cusp is broken or one wall of the tooth is broken, you're talking about doing something with either a porcelain inlay, onlay, or in the extreme cases, a crown.
So between like a crown, a filling, veneers, how would you decide what is best for that damaged tooth?
So it really depends on how much of the tooth structure is missing. If it's very minor, a composite resin is perfect. If it's more severe, where a whole wall or cusp of the tooth is broken, a crown or porcelain onlay is preferred.
And do damaged teeth decay more easily?
They do, because once the enamel is gone, the substance underneath is softer. It's made of dentin. So that's the areas where you can get the decay, and it can go into the nerve.
And what are the costs for treating a damaged tooth?
So a traditional composite filling could be as low as a few $100s. And if it needs to be treated with a crown, it's around $2,000.
And does normal dental insurance generally cover these procedures like crowns, veneers, and all of that?
If there is damage to the tooth and there was trauma and you can prove it, the insurances usually do cover it.
And if someone didn't have insurance, what other financing options would you offer?
So other great financing options would be CareCredit. It's a great option to pay over extended period of time versus paying up front at once.
Is there any tips or tricks or something that you recommend to your patients and just to the audience that they can do to have healthy teeth?
Just have good maintenance, take care of your teeth, have good hygiene, and don't forget to visit your dentist at least every 6 months.
Okay, thank you so much for that. Thanks for watching. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. For more information, visit carecredit.com.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.